Welcome to the program, everyone. I am Nnamdi Odipo. Things are generally fast changing in Nigeria. However, surviving and getting a semblance of life as it used to be would require a great deal and level of resilience, patience and strong will on the part of the people. And let's not forget that a lot will ride on the attitudinal change by individuals and the willingness of communities to improve on hygiene and environmental health. We will be discussing that as well as the growing level of ingenuity amongst Nigerians as they evolve their situations to cope with the challenges of living under the threat of the pandemic. My colleague is here, Elizabeth Omoruyi, and as usual, she will be hosting a discourse on the media review segment.
Well, this week we'll take a look at creation of content for media messages on COVID-19 and, of course, the role of media organizations in conveying these messages to the people without leaving anyone aside.
Very well, let's get going. The coronavirus pandemic may have thrown up different shades of pain, but it has also reaffirmed our humanity and given Nigerians an opportunity to showcase their ingenuity. Countless numbers have become face mask designers and makers, while production of sanitizers, which used to be substantially imported into the country, has now been conquered with local producers having a feed day. And that's not all. There are a few technological innovations seen in Western countries that are now being produced and fabricated here at home in Nigeria to aid in the fight against further spread of the virus. My first set of guests are reflective of this ingenious spirit of the average Nigerian. They all joined me earlier via Skype from different parts of the FCT. Yejide Ajanaku is the face mask producer. Deborah Itonha is a local producer of alcohol-based hand sanitizers, and Professor Edem Eyang represents a private sector group that fabricates human walkway sanitizing boots. Welcome everybody to Insights. I'll begin with you, Yejide. Let me ask you this. I've seen some of the images of you making the face masks, and I understand the drive, and now you've anticipated the market for face masks. But at what point did you decide to join the market, and how exactly has that panned out for you?
Thank you for this question. The turning point for me was when I thought of how I could contribute positively to the pandemic. From the facts available, wearing face masks is a preventative measure. Indeed. And getting the imported one was scarce and expensive. So I decided to make affordable and effective ones. I did research on this and checked that they passed the test of blowing a candle wearing the nose mask.
Okay, great. I'll come back to you because we've got a lot to talk about the process or processes involved in making a quality face mask, which also safeguards you against likely infection if possible. But I'll come to you now, Deborah. Do you feel confident that Nigerians have totally accepted locally produced alcohol-based sanitizers? I've seen pictures of you producing your sanitizer, and I understand that this is a venture you just got into. What do you think? What kind of response have you been getting generally since you began production?
Yes, absolutely. Nigerians have been accepting the locally produced hand sanitizer because we have realized that the quality of the imported ones it's same as what we can get here. So when it became difficult for people to import the foreign ones, we had to look within to sort for our local raw materials to produce the alcohol-based hand sanitizer. Now, the basic ingredient for locally produced hand sanitizer is the alcohol. Some people call it ethanol, the aloe vera, and then the moisturizers. So we found out that these materials can be easily sourced here. And of course, people are accepting it. It's as effective as the foreign ones. It's easily accessible, it's affordable, and of course, it's not difficult at all to use. The quality is quite high, And of course, I can tell you for a fact that I'm confident that Nigerians are accepting the locally based, alcohol-based hand sanitizer.
Professor Eyang, we've seen pictures of the walkway sanitizing booths in countries like Dubai, China, and the United States. Tell me about the ones you're locally fabricating here. We've seen images being like the ones that were just putting up on screen. Are the materials for these machines locally sourced? And in terms of standards and utility, how widely can they be applied in light of the space needed for installation?
I worked with a team of scientists and we came up with a design of this human disinfection booth that is primarily similar to what is obtainable worldwide. And this was a child of necessity, looking at the situation in our country when the pandemic caused the government to lock down the citizenry. And then for how long will we continue to lock down? How can people continue, to be at home, no work, no schools, and the economy was locked down? Our company decided to produce this machine that is very robust, efficient, and suitable for Nigerian conditions. Understanding our own environmental conditions, the peculiarity of our lifestyles, we looked at a machine that was capable of attending to the highest number of people possible without actually jeopardizing the security and safety in terms of the spread of human-to-human contact, whereby when somebody passes through this machine, wherever he or she had come from, the machine disinfects you from head to toe and also disinfects you underneath of your shoes by just passing through within a few seconds. And what is applicable is that we anticipate that corporate bodies, individual households, and public places.
Professor Eyang, if you don't mind, I would like to interrupt you here and come in, but I would like to ask you to back up a bit and take us through exactly how this machine works. You just made allusions to a person walking in and getting disinfected. Take us through the process of how exactly the machine works, right from the moment that the person approaches the booth, and then the motion sensors perhaps picks the movements, and then it sprays from the nozzles. And please just take us through the process.
Okay. Basically, once the machine is deployed, any human coming to the machine, once you approach the machine, as soon as you step your leg on it, the human sensor that is installed on the machine will activate the machine to release the disinfectant from above your head, from the sides, and up to your leg level. And when this happens, the disinfectant comes in the mist form and coats your clothing, your hair, whatever you are carrying on you, including your palm and so on. The moment that is done, you walk out. Under a few seconds, everything dries up. But you must understand that the machine is also fitted with a human fever detection thermometer. This thermometer is to enable the machine.
We seem to have lost Professor Eyang there. I'll come right to you, Yejide, if you're still with us there. Yejide, are you still there? Okay, I understand you're still there. Okay, Yejide, there are concerns over the quality of some face masks being sold out there. How do you ensure quality to dispel concerns over possible contamination before your products are pushed out to the public?
Okay. 3 things makes my face mask stand out from other sold by the roadside. The first one is that I did a lot of research on the internet on how to make a face mask that really serves its purpose. My face mask passed the blowing fire test. The second one is that after sewing the face mask, I machine wash, rinse with disinfectant that kills 99.9% 99% germs. I sun dry and iron them. The heat during the process sanitizes the face masks. Then the third point is that I package individually and still I don't allow customers to try them. And I also, if they need sample, I have samples for them that I use and nobody else. Thank you.
Okay, very well. Deborah, I'll come to you now. Deborah, if Deborah is there, Deborah, I would like to ask you this question. Of course, you're aware that at the onset of coronavirus infections in Nigeria, the prices of sanitizers skyrocketed. Actually spiked. And a lot of people were concerned. How significantly has locally manufactured sanitizers like the ones you make helped in reducing prices here in Nigeria?
Okay, thank you very much. We all know that when demand gets high, it's very natural for price of products to increase as well. So, and we are also aware that the federal government have been trying to promote indigenous products. So this has further enhanced the federal government policy on using locally made products. Now, the benefit of having the locally made hand sanitizers is that the raw materials are easily available. We do not have to import them. We do not have to pay duties on bringing the raw materials to the country. So everything is available, and of course, that actually had a positive effect on the price. So, for instance, you have foreign made the foreign hand sanitizers for say 2,000 naira for 100 ml bottle, and then you have the locally made hand sanitizer for less than 1,000. The difference is that the raw materials are easily available, they are easily accessible. The packaging, you do not have to spend so much. So yes, the price reduced as a result of the fact that the materials are easily gotten right here in the country.
Professor Ayang, I understand you're back, so I would quickly ask you this. Earlier on, you were talking about your boots and its workability. But at a time when we're gradually reopening society and people are struggling to keep safe, these boots will, of course, no doubt come in handy. Is there a model that can fit in front of homes? And since your materials, like you alluded to earlier, are locally sourced, perhaps they can be moderately priced as well and affordable by low and middle-income families?
Yeah, what we have done at present, we have two variants of the machine. We have a big variant that, comes in 3.6 meters in length and 2 meters, 2.3 meter high. But we also have a miniature variant of this same machine, which is just 2 meters in length and 1.2 meter in width, with a height of 2.3 meters to allow somebody that is over 2 meters in height to walk through easily. So this version is expected to fit into individual households where you can put them at your gate. The bank can put it just like the metal detector machine. It should be, in our own expectation, something in the like of a day-to-day security device, whereby every public place, individual household, as much as possible, can afford it. Because we are making it with local materials. Everything is locally sourced, apart from a few electronic components like the thermometer that is supposed to detect the fever. The whole body is made of plastic glass, transparent for you to see who is passing through, and it is reasonably light in weight so that it could be deployed. We have variants that use tarpaulin and transparent plastic as windows. So these machines are quite handy to make sure that it complements all the safety protocols that the World Health Organization has, designed for preventing this disease. When you wear your nose mask, you will observe the social distancing. wash hands, and stay at home. Whenever you are constrained to come out to the supermarket, to the hospital, wherever, we anticipate that if you pass through our machine, it will go a long way to prevent human-to-human spread of this virus.
Prof, we've talked about the specifics of your model and designs. We'll look at the futuristic or perhaps projections of how you've modeled your boots to be able to make projections on how it can help, or projections on how we can flatten the curve of infections in Nigeria. But before then, I'll come back to you, Yejide. The mask making industry is booming at the moment, with some face masks going as low as 200 naira and some as much as 2,000 naira, as a matter of fact. That's for those with designer labels. What should people look out for in choosing, or rather purchasing, a face mask? Shouldn't safety be uppermost?
What they should look for, number one, it should be cotton material so that they'll be able to breathe properly. Then the packaging, because when it's in, you can't, I won't say that you should feel it because it's already packaged and nobody will allow you to touch it. So, and I will also say that you should not buy from anyone that tells you that you can try it first. Because if that one is there, that means that another person have already tried it and packaged, and that is made of cotton, so that it will not be contaminated.
I'll start with you, Deborah. Okay, please continue. Please continue. I'm sorry. Please continue, Yejide.
Okay, I should continue.
Yes, please.
I said that anything good, any face mask that passes through neat process will not definitely come out cheap.
Okay, great. Yejide, I'll stay with you. I'm sure you've also noticed when you drive around parts of the FCT and you see people sell face masks along the road. I mean, would you advise people to patronize sellers like that who expose face masks to the elements and they are not properly packaged? In your opinion, if you are to give Nigerians and our viewer some tips, what would you say to them?
I will not encourage anybody to buy from them. Reason is not well packaged. And at times there was a period that something went viral that somebody used face masks, wanted to buy face masks, and tried about 5 before picking the one that she was going to buy. And you can imagine, assuming that person have COVID-19, the next person that is going to use it definitely
we're having some issues with the audio from Yejide there. I would move on to Deborah. Deborah, if you can hear me, Deborah, I'm sure you're getting some levels. In fact, you just spoke to how you're getting some feedback on your product. Do you intend to make this a sustained effort, or perhaps you will return to your main business in the aftermath of COVID-19? Is Deborah still with us?
Yes. The beauty about the hand sanitizer business is that we are all now aware that we have to be 100% hygiene conscious. As we
Deborah, I understand you have you need to enable your video. Your video is off. We can only get your audio. So while you try to do that, and we'll come back to this question, I'll quickly. Okay, you're back. Great, fantastic. Please continue, Deborah.
Okay, so like I was saying, we're all aware that it's a necessity. We all need to be hygiene conscious. And then the hand sanitizer is a preventive way of getting the virus and getting the bacteria, and also preventive germs. So yes, the business has come to stay. We hope to get more opportunities, and we hope to also promote the information that people need to use hand sanitizer more often. So the business has actually come to stay.
Professor Ayang, I understand you're back, and I did promise we will talk about your feasibility studies as a company in coming up with a decision to fabricate these walkway sanitizing boots. Did your group come up with projections on how these boots can help flatten the curve of infections? Did you perhaps create a scenario for a city like Abuja, for instance, and a model of how these boots can effectively help turn the tide in infection rates, for instance? Professor Yang, we'll need for you to enable your audio. If you can hear me, we can see you clearly, but we can't hear you.
That we, as a company, had looked at several possibilities.
Professor Yang, if you can also hear me, would like for you to move your camera away a bit from your mouth so people can actually see your face. Fantastic. Please go ahead now.
All right. We had looked at a few projections, and that is basically the fact that the number of people in some areas, for instance, in the FCT, we have different localities with heavy human population. If you look at areas like Mararaba Nyanya, which is very close to the FCT, then you see that as we gradually lift the lockdown, many people will come out from their home, they come out to go to markets, to go to shops, and so on. If everyone or the highest number of people are applying the precautionary measures, washing their hands, using the mask, sanitizers, keeping social distancing, and then combining it with the machine in public places like banks, where we always see people crowding at the bank, trying to use ATM and so on, this machine goes a long way to complement this. So the issue is, can we send the same machine to places like Lagos, Port Harcourt, Akwa Ibom, and so on? Once this is done, and people know that maybe as I go into this hotel or supermarket, I will pass through the sanitation booth where you will be disinfected, a lot of the problem we are currently facing will be eliminated. And we anticipate a 95%, safety for the community. Because as of today, we have not done enough testing in the society. We have not done enough isolation centers. So what is easily available to the people is putting these machines out there, even at churches and other worship places. You put it at the entrance. So long as the people go in there and they respect the social distance, they wear their masks and so on, they will not spread the virus.
Professor Ayang, as part of your corporate social responsibilities, but what are you doing as a group? You've talked about how important it is for us to deploy machines like the one you currently are fabricating. But what are you doing as a group to help governments in fighting this invisible enemy? Are you perhaps willing to make donations to government agencies and groups and organizations like the NTA so as to achieve a reduction in the infection rate across Nigeria?
We have gone out of our way to make arrangements to donate these machines even to the presidency. And to this end, a team of inspectors came to our facility from Aso Rock Villa to look at this machine and assess them. They use them by themselves, and they have accepted that donate this machine even to the president of the country. And this we are about to do in the coming week. Then, of course, we have also visited the NCDC themselves, and also we have visited even the NNPC, and we are willing to donate to these organizations so as to let people know that those machines they see abroad, they see on videos and so on, it's available here. And it's possible for us to mass produce them if we have that necessary support from government, from corporate organizations. We will make this machine to go around the country.
Professor Ayan, thank you so much. I would also suggest that you include the NTA in one of the list of organizations that you will be making donations to as well. I will come to you, Yejide. You were expressing some thoughts on the quality of face masks being sold in not just Abuja but across the country. I'd like for you to round off your thoughts on that matter, on that specific issue.
I can't hear you clearly, boss.
I'll repeat again. Earlier on, you were talking about the quality of face masks being sold around town and what people, Nigerians, generally should look out for in purchasing one. Can you quickly round off your thoughts on that matter, just before I get your final thoughts?
Okay. We should try to obey the instruction from the federal government. Then staying safe and staying home can never be overemphasized. However, if we must go out, then we need to wear a good quality face mask and take all the other health precautions. Thank you.
Okay, great. Yejide, I'll take that as your final thoughts. Let me quickly go to Deborah. Is Deborah still there with us? Deborah, let me quickly get your final thoughts too on all of the issues that we've raised.
Okay, so my final thought would be we have lots of potentials in Nigeria. Whatever we're importing can be produced here. We should patronize indigenous products. And we should use hand sanitizer regularly. And whatever hand sanitizer you're using should be 70% alcohol based and above. So we should all be conscious of the fact that this virus is real. We are not just making up, figures. And of course, I would also like to use the opportunity to ask a plea for the federal government to support SME, create policies that would increase the production of indigenous products in Nigeria. Thank you.
Thank you, Deborah. Professor Ayan, you're last but not least. The federal government has made available or has deployed and facilitated various initiatives to enable businesses like yourself to thrive. What's your final word on this matter? We're hoping that you do just as much as government is doing for groups and organizations like yours, and in that way you should be able to also effectively carry out your social corporate responsibility. What's your final words on some of the issues that we've raised, Professor Ayan?
Oh, yes. As my final word today, I want to say, just as we used to hear from the Bible, they say, ask and you shall be given. You have asked on behalf of NTA, and I can assure you, within this week, are going to receive our SON, Standard Organization of Nigeria, will give us our approval to mass produce this machine. Once that is given, NTA will receive one at your headquarters.
Prof, I want to thank you for being part of this program. It's been an exciting few minutes and picking your brains on most of on all of the issues that we've discussed. Ejide Ajanaku, I want to thank you for sharing your experiences with us. Deborah Itonha, I want to also thank you for sharing with us. Professor Edem Ayan, thank you so much indeed, all of you, for sharing with us. I wish you the very best, and I hope that you continue to keep safe. Thank you so much for coming on Insight. Well, Nigerians see opportunities in everything, and that is creativity at work. Going forward, scientists and health officials are unanimous on the position that as individuals we hold our fate in our hands and can determine to a very large extent our public exposure to the virus and therefore our safety level as well. Remember, the virus does not move unless people move. My next guest is a sanitary and environmental health officer. He is the Deputy National President, Environmental Health Officers Association of Nigeria. He joined me earlier via telephone from Lokoja. Dr. Solomon Ayegu, good to have you again on Insight.
Yeah, thank you very much.
The last time you were on the program a couple of weeks back, actually, the few confirmed cases we had at the time were mostly imported cases, and you expressed concern over community transmission. Well, unfortunately, we're there already as it is. Let's begin with the level of sensitization at community level. Do you think COVID-19 awareness and sensitization messages have been properly received by the people at the grassroots?
I do not think so. Because if the people have been properly sensitized, there's going to be a definite behavioral change. Presently, when you see people gathering in the markets, there is no social distancing observed by these people. When you see them in the place of marriages, there is no social distancing. Please, that's what the message has not gone down to the minds of the people. Because if an individual or a group of people are health educated, you will see it in the behavior change. So I do not believe that the sensitization has been carried out thoroughly for the people to actually translate into action.
But isn't that part of your responsibilities as officers involved in environmental health? I know your officers are experienced in community mobilization. How involved is your association in the ongoing awareness campaign, especially in states across Nigeria at the moment?
Yes, that was what we said in that our last episode. I said that the government at all levels should be able to mobilize the environmental health officers in their respective places to carry out thorough sensitization, health campaign, and education. But I do not think that in all the states of the federation, this is actually imbibed, and that is why we're having a problem. Because I did say that if this message must get to the grassroots, if this message must get to every Nigerian, we should be able to thoroughly identify the different segments of our human society, starting from the artisan, that is where we have the technicians, the welders, the tailors, the mechanics, the vulcanizers. You gather them together, you properly disseminate this information to them on the mode of spread of this infection, the basic signs and symptoms, the preventive and control measures. They'll be able to interact with the health officer, ask questions, and then there'll be a feedback. When the people are properly sensitized like that, there'll be a definite behavior change. Then you go to all other sectors, all other segments of the human society. We have the educationists, we have the road transport workers, we have the motorcyclists, we have the clergymen, the imams, the pastors, the farmers, the market women. No, they will be identified like that. And different days, they will be mobilized for proper sensitization. And I tell you the truth, by the time the message is actually understood by the people, they will on their own, as they go about their businesses, come up with a definite behavioral change that will not allow them to get the infection.
You know what? We'll come back to this issue, but I think we should just move forward. But I would, sometime in the course of our discussion, bring you back to just this issue about your involvement and the involvement of your association in awareness messages. But we do know, you and I know, there is no definitive treatment at the moment for COVID-19, and here we are with community infections on the rise. Paints me a picture, mapping out what strategies could possibly be deployed in balancing awareness and behavioral change to environmental health in order to influence a shift that could help flatten the curve of infections in rural communities within states.
Yes, I think I will still come back to what I said before, that government at the local level should mobilize the environmental officers within their domain. Government at the state level should mobilize the environmental officers within their domain. Government at the federal level, within the Federal Ministry of Environment, Federal Ministry of Health, other agencies that are environmental related should mobilize the people to still go back to the people to carry out thorough, well-organized sensitization, health campaign, and education. And it is when this is done, the message gets to the people that
I will interrupt you here, Doc, and maybe I should perhaps paraphrase or rephrase my question, because you've been speaking in generic terms now, but I have just asked you to, in practical terms, or rather just paint me a practical picture of how you could, in practical terms, deploy strategies to address these issues like you've repeatedly emphasized. Can you please create a scenario, perhaps, where in practical terms, like, okay, if I want to sensitize in community A, I would do this in practical terms. Can you perhaps just draw us an example or paint us a picture?
Okay, if you're talking about practical terms,
Yes, please.
what, take for example, maybe I, as an individual, being an environmental health officer, I am the one that is doing the sensitization. What I will simply do is this. I take from my community, for example. The community is made up of different segments of the society there.
Indeed.
We have the artisans, we have the clergymen, which is made up of pastors and imams. We have the Association of Road Transport Workers. We have the Association of Motorcyclists. We have the farmers. We have the youth. We have the educationists. So I will now schedule out a timetable.
Okay.
Now, in this timetable, I said today is for the educationists. I'll bring all the principals of schools together.
Okay.
I'll bring the head teachers together. I'll bring the teachers together, lecturers together, in a town hall meeting. And I will tell them, here we are today to discuss on coronavirus infection. And I will strategize out the lectures. Number one, what is this coronavirus infection? What are the basic signs and symptoms? How does it spread? And then, how do you intercept the transmission? How do you prevent it? And now, by the time I finish the delivery in a very practical, very simple, straightforward, maybe using the language they understand properly, by the time I finish that, then I will allow them to ask questions. And whatever they do not understand, as they ask the question, I give them the answer again. At the end of the day, everybody will be thoroughly sensitized. They will understand it. Then another thing again is said for the traditional council, the traditional rulers, the Madakis, the Dagos, the first class chiefs, the second class chiefs. I'll bring them together and I will now speak to them in the language they can understand. Talking about the basic information, what is this coronavirus infection? How does it spread? What is the basic signs and symptoms? What are the preventive measures? Then again, I allow them to ask the questions. By the time I do it like that, with different days set out like that, and you reach the market women, you reach the farmers, you reach the road transport workers, you reach the motorcycle association, and everybody will have gotten the message. Then the transmission will be very easy to intercept because the people will develop a behavioral change that will not allow them to get the infection any longer.
Yes, behavioral change. I have heard you speak on definite behavioral change as preventive for community transmission of coronavirus. Well, a lot has been said on the epidemiology of COVID-19. Do you think it balances with the level of awareness on environmental health, behavioral change advocacy?
Okay. Actually, the advocacy on environmental health is not adequate as far as this country is concerned. And that is why we are where we are today. In advanced countries of the world, there is a very balanced and adequate information on environmental health services. Like I said before, the major parameter or the major indices with which we use to measure the effectiveness of environmental health services in a nation or state is a drastic reduction in the occurrence of common communicable diseases and the possibility to elimination. But look at the sporadic and frequent outbreak of common communicable diseases in our nation. It means we are not doing well. And why are we not doing well? It means enough services is not carried out. Enough mobilization of the officers to carry out their work is not on point. And it therefore means that there is a call, a serious call, a serious appeal to all the secretaries of government to really reinvigorate, strategize, and face environmental services. Because prevention, we're told, is better and cheaper than cure.
Indeed.
So instead of us to be spending much of our resources on curatorial services, which is not even holistic, we can just put up measures by way of facing environmental services so that the disease spreading will be reduced via preventive healthcare services rendered to the people, which as of today is still very not well pronounced.
Well, since we're on the subject of environmental health services, I can recall that since the last time we spoke, a few things have changed with regards to the role ascribed to your officers in Nigeria. The Federal Ministry of Environment quite recently, I believe, directed groups and organizations interested in decontaminating their surroundings to contact your officers across the country. Tell me, how has that response been so far?
I think that directive by the Federal Ministry of Environment is the right step in the right direction, because we're talking about professionalism here. You cannot allow somebody who is bad to go and be carrying out decontamination. And if they do it, instead of actually achieving the target goal, they may end up destroying other components of the environment. You know, when you talk about the environment, we have so many components. We have the biological components of the environment. We even have some things that are very useful to the environment. So in an attempt to destroy a particular target organism and you are destroying other ones that are useful, you are causing harm to the environment. Professionalism, that is why professionalism come to play here. What I'm saying is that the local government, the state government, and the federal government should strictly comply with that directive by the Federal Ministry of Environment to recognize environmental services in their various states and local government to really carry out the decontamination of different premises so that we can intercept this transmission of coronavirus infection.
Well, fast losing time, Doc, I'd like to just interrupt you here and quickly follow up with another question that I consider quite germane, in spite of the recent acknowledgement of your role in the ongoing campaign against COVID-19. Some would argue that your group isn't still doing enough. In some countries, environmental health professionals are partners with medical and scientific experts, and they are in the forefront of decision-making, especially what it could entail reopening society like we're gradually reopening here in Nigeria. What level of input is your group currently making in key decisions, such as reopening of our society after quarantine? Very quickly, Doc.
Thank you very much. I don't need to be political here. I need to be professional, because the question you asked me is highly professional. You know, if you look at the presidential task force, how many environmental officers are there? The national president of environmental health is not there. The president of the Nigerian Medical Association is not there. What I'm saying is that the professionals are not there. And if you are not there in the meeting, how do you make an input? So the input is very minimal. I think if there is anything they are learning from us, it may be through these various communication media, the television, the radio that we're talking, and that some of them may listen to what we are saying. Well, there is no input. We have not been asked. We have not been asked to contribute, and I think that is why we are failing. And there is the need for us to really redirect our steps, reorder our priority, so that we can do things right, and then this problem will be really nipped at the bud.
Before I let you go, Doc, I would like your take on an issue. I would like to hear you speak on the disposal of medical waste and your association's recommendations in that regard, and whether it's been adhered to by those concerned.
Yeah, that is another very serious issue that we're talking about. You know, when we talk about the components of environmental health, we talk about one of the key components of environmental services is proper waste management. And when we talk about waste management, we have the liquid waste, we have the solid waste, and we have the gaseous waste. Now, again, we have the clinical waste. The clinical waste are waste that are coming out from the hospital environment or from the laboratory setting. Now, as this control of COVID-19 is going on, there is the taking of pathological specimen for
Again, Doc, I'm going to have to interrupt you here and very quickly because we're fast out of time. We're actually out of time completely. But have you made any sort of, or somewhat of a recommendation on how best to dispose of this medical waste?
Yes, the best thing to do is in line with what the National Council of Health said in 2008, 2009, 2010, where it is recommended that in every health facility, in every hospital, there's supposed to be environmental department. And if there's an environmental department, there will be environmental officers there. The environmental officers will also recommend for the establishment of an incinerator, a standard incinerator, and the establishment of a sewage treatment plant, like we have in University Hospital in Ibadan some years ago. Such things should be revived. Such things should be repaired. And every major hospital is supposed to have a waste recycling plant so that this highly pathogenic waste that is coming out from the patient should be thoroughly, worked upon before it's discharged to anybody of water. Else will be causing serious problem to the environment if these terrible waste from patients are not properly managed.
Dr. Solomon Ayegun, Deputy National President, Medical Environmental Health Officers Association of Nigeria. Thank you so much for sharing your thoughts with us on Insight.
God bless you. Thank you very much. Thank you for the time.
Well, that's it for our discussion and interview segment. I'll hand you over now to Elizabeth Omorui for the media review segment.
Thanks for joining us on the Media Review segment today. We will be examining creation of content for media messages on COVID-19. With everyone stuck at home trying to kill time, recreation and worship centers are missing their usual interactions with people. Content now has become king. How do we create content for media messages on COVID-19? Put it into perspective, the little ones and the youths. Today we will be chatting with Dr. Kazim Akinreti via the telephone. He's the chairman, NUJ Lagos State Council. Dr. Kazim, thank you so much for joining us on the program.
It's a pleasure being with you. Thank you so much.
All right. Our focus is on creation of content for media messages on COVID-19. Do media messages at this time target specific audience?
Absolutely, it has to be. For every public information, it has to target toward information, education, and entertainment. And so it must be extremely clear, it must be concise, it must be rhythmic, and it must be extremely appealing and directional.
Okay.
And you also need to do what the good is psychoanalysis of the audience in which you want to send the message to. For COVID-19, which is a pandemic, it has to have a global appeal, it also have a national appeal, and it also have a local content so that people can appreciate what the pandemic is all about. And any doubts must be clear from the concept.
Okay. Now, nowadays, we hardly see editorials dealing with generic issues. Is it possible that editorials target specific persons in order to drive home the message? At this time, we are grappling with COVID-19.
It depends on the way you look at it.
Okay.
Editorials have always been extremely specific and geared towards the goal. If you have watched the nature of the editorials of the pandemic, issues are taken one after the other to really underscore the essence of the pandemic. And it's not that the issues, for example, that are coming from the national briefing, the editorials are focusing on each and every aspect of it. It has to be the social distancing, it has to do with the protocols with regards to the barriers or socialization, the editorials are extremely clear. It also has to do with the the managers of this affair, the COVID-19 affair, is also very clear.
Okay.
And it is also directed to how to ensure the enforcement of those protocols. That is also very clear through the editorials. And the editorials are very good too. The editorial comments of newspapers, news analysis of radio, and short picture or documentary from television stations.
Okay.
Now, all in all, the new media, there is a mix of all these GR in ensuring that the methods of COVID-19 are properly addressed.
Okay.
People are just sticking to the protocols.
All right. Dr. Kazim, do we have messages targeted specifically at children in order for them to learn at this time?
I think that is one area which the messages today seems to be lacking, which I've drawn the attention of our colleagues to this aspect.
Okay.
But in tandem, those ones that are revealing that have to do with songs, that are targeted at children, so that it can be like a rhyme. But we also need particular messages in which the children are involved. But you know, the reality of the media law that you cannot expose children under 18 to certain advertorials. However, what I think we need to do more now is to focus on what happens if the school resumes.
Okay. That's a very big issue.
Because either we are unlocking the lockdown now gradually, but it's phase to it. So when we get to this open the schools, we need to redirect our message. We have to capture the children in particular. Because either we like it or not, children will coexist. And they will want to hug themselves, they want to take something for themselves. So we need to do messages that will be targeted towards this end. That I think should be what we should be planning as of now. But for adults, I think all the messages was quite clear, were quite concise, and they're also quite directional.
Okay. All right. Final question, Dr. Kazim. What role should the media be playing in this, in building of content?
Our roles are clear. We do advisory roles. We play advisory roles in informing, educating the people. One area I've been warning our colleagues to desist from, we are creating too much panic, and that is unnecessary. Reading out the figures is not the issue.
Okay.
What are the essential solutions? Let us target homegrown solutions to the pandemic.
All right.
Let our messages focus on traditional medicine. Madagascar has done quite well, and they got it right. They are exporting those traditional medicines across the globe. So Nigeria cannot be lacking behind in this respect.
Of course.
So I expect the media now to focus more on those traditional herbs that can stop this pandemic, because this pandemic has come to stay, either we like it or not. What happened in Spain in 1918, the Spanish flu, how was it curtailed? What happened in 1940, how was it done? Even the SARS and the HN1 bird flu, how were we able to contain that? That is the focus of the media.
Yes.
So looking at the figures, today the number has spiked. Does not excite me as a practitioner. So I want to see the media showing depth, showing understanding, and being more professional in finding solutions to the pandemic.
All right, Dr. Kazim. Thank you so much for your time. Thank you for chatting with us.
Okay, thank you so much.
That was Dr. Kazim Akiriti, Chairman, NUJ Lagos State Council. And that's it on the Media Review segment this week.
Though this is where we'll call it a wrap, there are no goodbyes from us as we hope you stay tuned to the NTA and we'll see you pretty soon. My name is Nnamdi Odipo Elizabeth.
And I'm Elizabeth Omori. Keep staying safe and obey all the rules.
The following guidelines for eased lockdown as announced by the Presidential Task Force on COVID